administration to make sure that that happens, and that's really critical for our community, that we get an accurate count and a complete count in the census, because that really drives how funds come into our state. And so we'll be supporting that administratively. Just a reminder, Bike to Work Day is Friday. Hopefully you're participating. I don't know if you guys have an assembly team. I think I pitched that last time.
It's just John Weldon.
He's representing for the crew.
I would join him, but I'm going to be out of town. So.
On the cemetery front, the bell tower, I think some of you may be familiar with that. That has finally gotten full funding, and they're going to be breaking ground and getting that done. And then when it's completed, they will do a ribbon cutting ceremony and be asking and inviting the assembly and other folks to participate in that. Let's see. There's a whole bunch of. Oh, go ahead.
Did the Muni come in with funding for that at all? Or?
I can't recall. I'd have to go look. I know. I remember we had talked about it, and there was some discussion, but I don't know. I'd have to pull it up. There's quite a bit of beetle kill, just so that you guys know. For those of you who live in or around or are used to seeing the cemetery, we removed 7 trees last year. We'll be removing 4 more trees this summer, and most likely there'll be more trees going. These are 100-year-old trees in some cases, and so it's going to dramatically shift the way that cemetery looks. So it's just something for you guys to be aware of. Let's see. We're almost done with all our grant submissions. All of that's kind of going along. Animal control, I know you guys are always interested in that. There should be the AM and AO on its way to you guys with the Title 17 proposed updates. Animal control is getting a new roof that started next week. Let's see. I'm just trying to think of things that are highlights of importance that you would really be interested in.
Ms. Pineda?
Oh, go ahead.
Ms. LaFrance.
On Title 17, what do those updates pertain to? Just a real high level.
The advisory board has been working on it for years, so there's quite a package of changes that they have, the committee and the advisory group has been working forward on. And if you guys would like any kind of briefing or something in advance of that, I could have Deanne, we could have another alternative meeting where you guys could get those answers to your questions and review it. Because basically there was a stopping point, because there's still other changes that want to be made, but there was just, they've been belaboring over it for so long. We wanted to make action happen, and then they can start on the revisions that need to happen for the future activities. I just can't tell you exactly which ones those are today.
Well, maybe we could have that discussion here at this committee. Once they're ready, then we could distribute it and have a conversation.
Yeah, I feel like they'll be coming soon, so maybe it'll be good for June. Up to you guys.
Okay, great.
We can check with Deanna and find out.
Great.
Community safety and development, that I know is of interest. The 2019 action plan, so the HUD funding plan for 2019 should go out to public comment in the next couple of weeks. And that is basically how we're going to appropriate the HUD funding for the 2019 year. There is also, so Steve, one of the big change we had is Steve Ashman retired, and so he's our division manager, so I'm the current division manager of that division, and learning a lot about the HUD funds and how we do that work and the community engagement and how those funds are allocated in our community. So we'll probably be making some changes to that and in the near future, and so I'll bring that back to you. I know you had brought up, Christopher, questions in the past about the comp plan. Go ahead.
The 2019 year, October 2019 through, or what is the year?
No, I believe it's, it's due to the feds by August 15th. I think we're 1 year, and not in arrears, but we could be submitting our 2020 plan this year as well. But right now we're living in 2019 off using the 2018 funds, and that has a lot, and I'm just learning about this. This has a lot to do with how the feds appropriate the HUD money and whether or not their budget passes in a timely manner. So we submit the 2019 plan. Technically it's supposed to start in October, but it never does. It usually takes until February or so of the following year. And we oftentimes, if we don't have a project, you'll see TBD, which is to be determined, because we can't put in a project unless it's fully ready to go. And then for new assembly members, the way that works is that a substantial amendment would occur to the plan, and that would come through the assembly and go through the same public comment process. So it's kind of a laborious exercise to earmark those dollars. So this will be the 2019 plan, but you'll also then see 2018 amendments because there's money that still needs to be reprogrammed from the Hope Center and some other funds that had not been expended that we would want to put towards some projects. So we're looking at a few things that we would like to put forward.
Thank you.
Mr. Rivera?
Thank you, Madam Chair. So on the same topic, one of the difficulties that we have in this is that we have historically relied on the HAM Commission to inform the Assembly on the funding and what it's going to be used for to provide any recommendations or insights. And because the federal funding comes in so late, they haven't been able to do that process. So when I went to the HAM Commission some months ago, I talked to them about how can you get us your thoughts and recommendations, because we want that insight. And so I'd like to see if there's an update from the HAM Commission on this.
Okay, we can ask them.
And we should probably try to wrap up the update
Yep.
quickly because we have a big agenda.
Yeah, I don't think there's anything else here that you can't live without knowing. Other than that, we're moving into EWIC, so you'll see a lot of communication coming out about EWIC from the state and from the local, and that's going to kind of transform how women and children access those benefits and make it hopefully a lot easier. So that is all.
Thank you, Ms. Pineda. So who's going to be leading us through the substance misuse assessment part 2?
Really, Sarah is,
Okay.
but I don't know if we wanted to. Are we still gonna? How much time do we need for the tobacco discussion? I just want to make sure we honor the time and are able to get through that.
I'm concerned we're not going to get
Okay.
done with all
So-
of this.
So we can.
We haven't even seen these. Dean's been working on
Okay.
it, but we haven't seen them at all. So I don't. Yeah, I think we should just.
You want to do the policy analysis?
We don't have a lot of the members, the nonprofit organizations here, so we could shorten our Tobacco 21 conversation and do some of it at a later date potentially. But yeah, Dean.
I can try and get my part in about 15 minutes.
Okay, that sounds great. So maybe
That's
about
without questions.
True. So maybe about a half an hour, and then we could go over
Okay.
if we need to. But I just wanted to say
We
before
can
we
start
start,
here.
so we already started discussing these last time. Some really interesting information we got from Ms. Pineda, Ms. Richardson, and we're hoping to make this really practical and be able to use it to make policy recommendations at the Assembly. And we covered about half, maybe not half last time.
Yeah, I don't know if we even got into the actual policies, so I'll let Sarah just take it from here. We wanted to make sure that you know kind of how we worked with our commission, what the process they went through in analyzing it, how they scored it, and then how we're going to operationalize the recommendations as well. And if you would like, since I don't think we actually walked through any of the policies, we could just describe them all if you'd like as a starting point. If we have a half hour, we have enough time, right?
Yeah, and then before you get started, I know that Ms. LaFrance and I just wanted to say thank you from the whole assembly to Ms. Richardson. This is her last meeting with us, and she's been serving as an Alaska Fellow, and she's done an amazing job, and we're really thankful and think that these the work you've done will make the city better. So thank you. Thank you.
Should I just start with these?
Yeah, I'll just hand it.
Okay, so the last 2 meetings we went over the key findings or kind of high-level findings from the report. So today we're going to talk about the policy recommendations that came out of that. To start with, the general breakdown in understanding public policies, distributive, regulatory, and redistributive policies. We are not proposing any redistributive policies, but just to go over them, distributive is typically a policy that provides benefits to a group, regulatory regulates or restricts, and then will redistribute goods and behaviors.
Can you either say that more slowly
Sure.
or say it again?
Okay,
Probably
so
both.
generally within the scholarship of public policy, there are 3 kinds of policy that are understood: distributive, regulatory, and redistributive. And you can understand them at a really broad level as a distributive policy does exactly what its name says. It provides benefits or goods to a group or community, and typically those benefits are paid by the whole community. So subsidies or education policy would fall typically under that kind of policy. Regulatory is much more like what we tend to think of as a policy. It regulates behavior. For example, you have to wear a seatbelt. Your Tobacco 21 ordinance falls under that, regulating the age at which you can purchase tobacco. And then a redistributive policy is something that takes from one group and distributes to another, and the costs are borne by that small group. So we proposed at the outset, or after the assessment was finished, we collected 20 policy recommendations addressing substance use, misuse, and addiction in Anchorage. we've broken them out we have 9 distributive policies, 9 regulatory policies, and 2 that just kind of don't fit in either place. So I'll just, tell me how quickly or slowly you want me to do this, but I can do a quick overview of the 20, but we actually landed on 7 that we would like to recommend for both the health department and the assembly moving forward, and I'd love to deep dive into those a little bit more.
Maybe we should just skip to those, and then in your report, does it have information about the 20, and you're familiar with those, so we could maybe prioritize the 7 and then go back to that later with
There'll
you?
be a flashy executive summary.
Okay.
Maybe it's like 6 or 7 pages that's attractive and easy to read and consume, and it will include kind of the high-level data points that we cover, the findings,
Great.
and then the policies, and then the policies that address those findings, and then the comprehensive report, which is multiple hundreds of pages, has all of that information included. So yes, we have it, and then we have Jen, who's with us with Counterdrug, who's going to be with us for the next year, replacing Elijah Gutierrez, who will also be able to help us do some continuity with our work around substance misuse, so it won't fall to the wayside, and we will continue to do that work.
And maybe before you go through the 7, you could just speak to sort of generally why you selected those 7.
Sure.
How we did it?
Yeah, sure. So what we did was that as I was doing the assessment throughout the last 7 or 8 months, we were also doing literature review and collecting best practices on policies to address substance misuse kind of nationally and internationally. And then when we came up with our high-level findings, we did even more research into specifically with those findings, how can we address, what policies are best known to address those issues. So we created that list of 20, and then we used the tool that we see up here that's a CDC tool to evaluate policy based on 3 broad criteria. The first is impact. What impact will that policy have on public health outcomes that you're trying to evaluate? The second is feasibility, and we look at political and operational feasibility. So political feasibility generally is just how likely is this policy how likely is it this policy will pass or move forward given political forces in the community, and then operational as well, the logistical kind of like development and enactment of that policy, how easy or difficult would that be? And then the final one looks at the economic and budgetary cost of the policy. And so we did our best to estimate for each of the policies that all 20 of them that we looked at, how much would it cost to just enact this policy, and then what would the economic cost benefit be for the community for enacting that policy. So we collected data for each of the policies on all of this and sent that to our commission and to the health department leadership team, and they evaluated, can you go to the next one? They evaluated each of the 19, basically saying low, medium, or high or large for each category, and then we met as a commission and leadership team. We collected everyone's scores. The highest score that a policy could receive is a 12. You don't need to get into the details on that, but we basically ranked them out in terms of total score across all 3 indicators, and then we also pulled out total score on impact alone, because we did find that the feasibility of several policies was pretty low, and that lowered their overall score. We wanted to kind of represent the ones that the commission and the health department leadership team believed would have the highest impact, kind of leaving that feasibility and cost to the side for a minute. So we have a summary, and it's kind of a lot, but what you can see on the orange table is the top 10 policies ranked just by their total score. So out of 12, and you have it in your handout too, which policies did the commission and health department believe were kind of the most feasible, highest impact, and best cost benefit, lowest budgetary costs. And so you can see these are abbreviated names for them, but the first one was that the health department will distribute Narcan. The second is the passing of an alcohol tax. The third is tobacco 21. The good thing is that all 3 of those are in some place of already moving forward, or in the case of the alcohol tax, did move forward to a certain point. And then 4 and 5, the municipal language change is a policy just really simple, basically asking that the code of ordinances changed from the word abuse to misuse when talking about substance use. And then the last one is expert at screening, brief intervention, and referral to treatment policies within the health department, which basically allows someone with an addiction accessing our services to have a clear procedure and policy to be linked to treatment if that's what they need and screen for that. And then you can see, as I said, we tried to separate out all those total scores just by impact as well. So the first one came out as housing first is the highest impact score alone. which, as we wrote it, was just the Assembly would issue a resolution in support of true housing first development in the community, but it could also be reworked to look at going after housing first funding, or look at what that might be at a stronger level, because the Commission really did prioritize that housing piece. And if you're not familiar with housing first, it's just basically really low barrier housing that allows an individual that has an addiction that might be currently using or misusing substances to still access that housing despite those other issues, and then receive wraparound psychosocial supports while they're accessing their housing. So basically the fundamental principle being that you can't get sober if you don't have a house. And then on the third one, after the Commission ranked all the policies and we sat down and looked at the rankings that they came out, they had a discussion about whether those rankings really reflected what they wanted to prioritize and thought. And so in green, you can see kind of that it more or less aligns with their top ranked policies through the top. And then at the bottom, they really did want to prioritize Crisis Stabilization Center, the creation of that, and also just investing in extracurricular activities for our youth as a key prevention intervention in terms of diverting youth away from using substances and into something productive and healthy. And you can also see ACEs and trauma and racism and institutional bias training for municipal employees also came out higher in their kind of conversation than it did in the rankings. Do you have questions about that? It's kind of a lot of policies, I know.
I guess I have a question. So in the booklet you're going to give us, it's going to have each of those policies and then a discussion of why it's needed, what would be the benefit, how it would maybe work with current rules or code, or how do we sort of take this and implement it?
I don't have the sample. Yeah, so basically all 20 of them will be listed in the final report, and then exactly as you said, kind of like why this is needed. And for each one, it depends. For example, the Crisis Stabilization Center, we only have so many estimates, and there's a lot more pieces moving than for some of the other ones. But yeah, like we'll provide you with enough information to begin that conversation. Some of them are very straightforward, like a Tobacco 21 ordinance, and some of them, like extracurricular activities, is a conversation about how you want to fund that and what the best places moving forward are. Yeah.
There's about 2 pages for each. For each one of these policies, the Commission was given a multi-page document and other resources that help them understand that particular policy, and so that can be made available to you as well.
Thank you, Madam Chair. Under the Commission's top 10 policies, EPR ordinance, extended producer responsibility. What is that?
Basically, that is that you ask manufacturers of medicines that are sold in your community to pay for the costs of disposing of those medicines. So in places where it's operational, which is mostly in California, and has been tried in the courts and deemed legal, it basically looks like manufacturers paying for kiosks set up in pharmacies, paying for a certain number of events each year that publicize that it's important to take back, things like that, and all costs are gone to the manufacturers.
Thank you. Yeah, Mr. Plummer.
I apologize if you've already gone through this in one of your earlier presentations, but just very basically, when you say impact, what exactly are you measuring? Is it morbidity rates? Is it some other measurement of the human cost? And what exactly are you quantifying?
Sure. So it depends on the policy. So when we're looking at crisis stabilization, we try as much as possible to look at as many health outcomes as we could. So like the hospitalization rates, morbidity, and mortality, as much as we can get for Anchorage specific. When you're looking at a policy like changing the municipal language code, we have very little data on like what the impact of that might be. So it really depends on the policy, but we tried to estimate as best as we could what the impact would be depending on the policy. Some of them address alcohol, some of them address tobacco, some of them are more broadly looking at stigma, and so it's harder to...
But can I ask a quick follow-up? So that means that, but if you're using slightly different criteria on the different policies, that means you're not really making apples to apples.
Sure, yeah. But then they're taking the data, they had the assessment with them as well, and they can see that like alcohol seems to be a bigger problem in this community if you look at it in one way than heroin. And so should they then, it's all very qualitative in that aspect too. So the end result is currently we have kind of 3 buckets of policies that we would like to move forward on. And the first one are 3 policies that the health department will move forward on. enacting a policy allowing for Narcan distribution, which is actually in motion right now, enacting that screening, brief intervention, and referral to treatment policy, which I mentioned earlier. It's called SBIRT, and that's when someone enters our clinic or another service and they're screened for having an addiction or a problem use with a substance. And if it turns out that they're screened really high as really having a true addiction, then we will connect them in a warm handoff policy to treatment providers within the community. And then the third one is officially indicating our support for maintaining current alcohol sales hours, explicitly stating our opposition to increasing those hours. So we'll write a policy to that effect. And then the second bucket are the Anchorage Health Department will recommend that the Assembly pursue the following four, the first of which you've already working on, Tobacco 21. The second is to re-pursue the 5% retail alcohol tax. The third is that municipal language change, which I addressed, which basically would be accompanied with a short training for all municipal employees and kind of an online or like very brief 5-minute kind of deal, explaining why we're shifting from the words like abuse and alcoholic and addict and junkie to words like misuse and substance use disorder, to really chip away at some of that really pervasive stigma that exists in the community. And then the fourth one is to pursue funding, allocate funding for the Alaska Center for Treatment Project, which you should talk about.
Should we talk, when we use the word allocate, we struggled a little bit with finding the right word, because in some cases it's not that there's going to be municipal funds used for that, but that we're going to go after funds, and we're asking for the support of the Assembly to allocate those funds through the Assembly process. And so we could not find the perfect term so that it wasn't confusing, because we don't want you to think we're like, hey, could you give us $17 million? But when we come forward and we do have a complete and total project, like you approved the $5 million grant from the state, that you would continue to support that project, just as a clarifying point.
That actually raises a question. We have a chunk of money that was awarded to us by the state, and
Yes.
there were some questions that I had heard that money might be under threat if we don't encumber it. Have we encumbered it, and how?
The state has, the procurement officer who manages that and the way that money comes through is pretty strict with how they let us draw down money. It is a 6-year grant. We're in year 3 of it, so there is no, we're currently in a grant agreement for that period of time. We have only drawn down enough money to do the pre-planning work. We have not drawn down the design money because we don't want to pull down that multiple, it's a pretty big chunk to pull down if we don't have a financing plan in place. And so we're working right now on that to make sure that there is an ability to move forward with that project prior to pulling it down.
So there is just a slight risk there, because I have heard rumblings in the division that that's a low-hanging target for additional funds for their administrative efforts if they can get their hands on it.
Yeah, I've heard and talked to them too. I mean, it's a 3-year grant. I mean, we've got 3 years left on that grant, and it's, as a grant manager at the state, I know it was really, really, really difficult to take away people's grants. Maybe they find a loophole. But we're moving forward in good faith and not pulling down money unless we can actually spend it. So maybe that's a risk, but we could start design. I think it's a good idea, but that's still about, I think, $12 million that has to be secured.
Thank you.
Okay, and then the
Mr.
third.
Dunbar has a question.
I'm sorry, this might be later on the presentation, but it strikes me that 2C was relatively straightforward. Is there an ordinance already moving forward on that?
No, we haven't done anything with those. The only ones that we have done are the ones that were starred.
Oh, they're not stars here. Basically, the Narcan on the first one.
We're just getting that one out because they're the ones that we can control internally in our department. I'm trying to move forward anyways.
So I know 2C is a recommendation that we do it, but if y'all could draft it, that would be great. Since we
We
don't
will.
have it.
Yeah.
We will, yeah. We would work with you guys on any of the ones that we're recommending that you do. So,
And then the third bucket are kind of what we're calling, if you think of 1 and 2 as the things we are recommending to start now and start moving forward in the next 24-ish months. Bucket 3 are things that came up as really high priority, really important to the commission, to the health department, and certainly to everyone that I spoke to through the assessment process, but that right now we're going to have to prioritize kind of beyond that 2 year, but still want to really highlight them as kind of the next most important. So that first one gets at requiring all municipal employees to attend training on, and then it lists a lot of things: adverse childhood experiences, trauma-informed care, cultural competency. These are not individual trainings, rather kind of a group of competencies, knowledge that we think that municipal employees generally should be better equipped with. B is that Crisis Stabilization Center. C is looking at funding for the provision of free or inexpensive extracurricular activities for youth. And then D is supporting the development of housing first. So to kind of think of those as our priorities beyond these initial policies would be good.
Madam Chair,
Yeah.
I would just add, if you look at any of the capital investments the community has driven for the last 8 to 10 years, the only thing we've seen increases in are housing first units. We're not seeing increases in treatment beds. We're not seeing increases in any facilities to deal with the other issues. And so I think we're well on track to that, and might even be slightly out of balance to that as a policy in our community, because we have to keep everything in order. So just kind of keep lifting all ships.
Well, one thing I struggled with a little bit, or we didn't really necessarily capture here, and we'll keep talking about it, is the, for the treatment center project, we're proposing this 3.3 ASAM, so we're proposing a level of care that isn't available in the community anywhere in the state, and it's critical. It's our very vulnerable populations that cannot stabilize, and it's necessary and it's expensive, but there is a problem with funding of existing beds. And there are providers that have existing beds that if they could be funded to pay for those beds and the treatment for those beds, we would have more treatment access in the community. So we talk a lot about that in the report itself. And so there's room still to say, we just need to think about that because it's a missing part of the puzzle. And it came up when we were talking about crisis stabilization in the fall. And as I've been meeting with providers, and even though we don't have a role in behavioral health per se, because we're not the single state agency and the state is in charge of our behavioral health system, it's very clear to me that either we have workforce issues and they can't staff those beds, or they do not have the money to staff those beds. But that doesn't mean that we don't still need to make space for the 3.3 level of care, because we have a population that just tends to have higher levels of brain injury and biological brain damage. And so you'll see that in the report itself. It's not here. It could be. It could easily be added to advocate strongly for right-sizing how we fund beds in this community.
Yeah, because if I might just follow up with that, you do a good job of talking about the treatment center, but that is kind of an outlier, right? Because everything else is a function of some kind of a engagement, function of humans, touching humans, or not everything, but just about everything. And so it might be wise to include some plank along those lines. And not just
Somewhat.
substance,
I'm
a
sorry.
plank along those lines.
Yeah.
Also the behavioral health, the other side of the behavioral health coin, which is the mental health piece, that is the partner to that issue.
Yeah.
So.
And Ms. Altel had a question as well.
I missed maybe what do we contemplate a crisis stabilization center being?
So there's a lot of different ways that people have interpreted crisis stabilization. Last year, the legislature put money out for crisis stabilization, and they identified it as one thing. I think the trust has, and the fire department, and there's quite a lot of partners who are thinking about what a crisis stabilization means here. There were some folks that feel like it's like a comfortable, the way I've heard it described, there's a couple different ways, that it's a safe space to go, basically move out of acute state that doesn't require emergency room level care, or being placed in a facility, but to be essentially stabilized, reconnected with your services, maybe reconnected with your medication or your case manager, or maybe you're just an individual who's having a crisis but doesn't need to go to API or ER, and you can stabilize there. I know that in my discussions with the fire department, they've seen it as a way to divert from ER people who are in crisis that they come into contact with. So there's a variety of different ways it looks, but ultimately it's a no more than 5. I think there was a debate about whether it's 72 hours or 5 days, and you're going there on your own to stabilize.
So voluntary. So not like the Providence Crisis Recovery Center. So
Yes.
voluntary, time limited. We get you hooked back in, and hopefully we get you back
Right.
in the community.
And that we keep you out of ER beds, but Yes.
And it doesn't require any kind of like Title 47 certification.
Not at all, no.
Fantastic.
Yeah, so there's a lot of energy and support around that, and I think the trust wants to provide space for it. The biggest issue we ran into when we were talking with providers, and this is where I really got to know more about why, like, the recovery center itself has space, but they don't have enough staff or funding to fund those spaces. And we learned a lot about the fact that they can't pay to operate it. So we can get a building, you can get it put in place, but how do you operate it? How do you pay for that?
What about the new Medicaid waiver we're looking at, that the state's looking bringing on the 115?
Yeah, the 1115 waiver. So what, we
waiver.
didn't have that at that time, and there was no clarity on what it would fund, and I think there's still not very much clarity on what it will fund,
Okay.
even though it's published. Oh, they
Yeah.
did recently, like in the last couple
2 days
days?
ago.
Okay,
That's
so,
a public comment.
yeah, so we'll look at that. I mean, that's the same set of regs that we were waiting on to kind of see whether or not, depending on, that will really impact the cost of the treatment center that we're proposing as well.
Okay.
So we'll be looking into that.
So-
Follow on just quickly, just that, last year, or maybe it was now 16 months ago, there was a solicitation that was put out to fund this service. There were no offers because the money was just
It wasn't
insufficient.
enough, yeah.
It was impossible to deliver what they had been asking for, which is a classic circumstance out of DBH. And so,
And we went and asked
They
them in
tried.
person and sat down with them and described the scenario that we saw at the community level, the mayor. We all went in and talked to their leadership, and they were unwilling. They had a vision of what they wanted to fund and how they wanted to fund it, and that money went to Juneau.
Do we know per day, per bed amount?
Yeah, I think we worked out the costs, and it's very cost prohibitive. So we were working with
Love to have that.
Providence and the police department and trying to price out how much something like that would cost. Because the one we were proposing was that it came along with a coordinated team from the ER, police, fire, that had the social worker all together so that they could make a field determination of whether or not that person needed to go into care or could go to crisis stabilization. And that is the expensive
That
part.
number's buried somewhere in email. I would love to
Yeah,
see it.
I'll see if I can find it.
Thank you.
Thanks for all the questions. Yeah, Mr. Gates.
Thank you, Mrs. Chair. I was wondering if this stabilization center funding for the capital improvement is related to any bond?
No, there's no money now for crisis stabilization. It was a legislative appropriation that was one time, I believe, last year.
But is he asking, could we bond for that? Because it's a building. Is that what
Oh.
you're asking, Dean?
Yes.
I don't
we
think the
really
building
don't
is,
have any
yeah, I
appetite.
don't think the building is the problem. Like, I think that if there was a desire to have it, the trust has already made it clear that they want to step into that space and help. It's the operation costs, which basically hamper up everything in this world.
The reason I ask is because oftentimes the bond propositions include, if it's going to increase operations
Yeah.
and maintenance costs, they include a portion that says authorized to increase the tax cap to pay for those costs.
Oh, for those
operating
costs, yeah.
It sounds like that's something to use operating cost funding. If there were a bond associated with this funding, it would be something to look at to anyway.
Oh, that's good. I didn't know that.
It's probably too much.
it's too
but,
much.
But
Yeah.
it would be
It doesn't
interesting.
fit
It's
into
interesting.
OEM. This is a program. It has to be a program that's substantial.
Yeah.
Just sort of in the interest of time, if everyone's okay with it, so just to clarify then, the 7 that you were speaking of are the 3
1 and 2. Yeah.
that the health department will do, and then the 4 to us. I mean, we're working on Tobacco 21. That's what we're about to talk about. Obviously, the alcohol tax is something we're interested in. I'm sure many of us want to bring that back at some point. And then it sounds like C, you were going to put together some sort of package, as Mr. Dunbar asked, and then. So I think we can just continue some of these conversations.
Yeah.
D is contingent on B.
Yeah, basically. Yeah,
Yeah.
D is related to V. So maybe there
It
are
really
other
is
things
at
we
the end
could
of the
do.
day.
I mean, if those are sort of big things that, we might not be able to accomplish here, even though we can certainly support and encourage, but maybe there are other slight code changes or things we could do here too, so we can kind of dig deeper.
And we're working with a community coalition that's trying to form around substance misuse exclusively, to have them take on some of the other items that didn't show up in here. And they're kind of a coalition with the hospital providers, a bunch of focus on substance misuse treatment and other things. So we're going to try to collaborate closely and move on some of it to them as well, so that we can partner in that space. So
Great, and I think if there are others that we could, you know, if we're doing what we can here, but there are other things we could work on that don't involve funding, you know.
yeah, there's the
Housing or
EPR.
something
There's
we
the
can't
full
do
list
alone.
on the back. There's 20 of them, right? So the EPR, the ERP, is it ERP? I still can't.
Extended
EPR.
producer responsibility is an ordinance that y'all could pass.
Yeah, I
with
mean, I
low
think
cost.
that's, it would be nice to see us, I mean, we could just work
Yeah,
through
you guys
those
could work
in
through that.
committee and then put them forward, so.
Yeah, and there's some
that's
study
something-
ones where you're like, you know, I'm going to keep those pegged for if I get an MPH student that's super ambitious, that really wants to do the density, alcohol density project, that we put them on that. So
Well,
we're
there-
going to kind of use it as a blueprint, I guess,
Yep.
to keep us focused. And if somebody comes to us and wants to work on this issue, we're going to stay in this space because it seems feasible, possible, and there was some evidence that indicated they would be good.
That's great, and I think there are, different members who might be interested in different things and want to involve everyone as much as we can. Mr. Dunbar?
Is the health department applying for another elastic fellow for next year?
We didn't have any money, so we did not. And so that's the other thing to keep in mind,
You have
is that
to
this is all
match.
being done voluntarily. So we were so lucky to have Sarah and OMB paid for her. We won't have one this year. We do have Jen that's going to be with us one day a week, who could do some of the projects with us. But this is a passion area for me, so it's something I'll do if I have time, or look for students, or, I'm kind of putting this together as we go forward, just because we had a gap in this substance misuse space, and we can't not address it. It's a symptom and a contributor to many of the problems that we are working on in every other committee that you guys are probably in.
I think we need to move on to Ms. Alfell.
I'm not sure, were you responsible for creating a lovely booklet of resources for substance abuse treatment centers?
Yeah.
Fantastic, good job. I just
Yeah.
got a copy of it at the library with the social workers. So I
Cool.
have to say,
She's
it's
done that. Yeah, Sarah's kind
I'm
of
carrying it with me.
made
you
us
can
look
bring
really
that-
good
bring
and
that to the
smart.
next
Yeah.
meeting, so-
Yeah.
So I guess
So
we'll-
next meeting we'll have the executive final glossy
Great.
summary. You'll have the final published report, and we're going to kind of use the meeting as the time to say it's public now. We're sharing it with you, and then we'll make it available on our website at that time. And so we won't need more than a few minutes just
Okay.
to share with you. I could do it in my director's report, and you guys can use the rest of the meeting for what you need to use it for.
Okay.
But we thought, since
Great.
you guys have come on this journey with us, we'd share it at that time.
Thanks very much. So I think we could move on to talking about Tobacco 21. Dean took some comments from all of us, I think, and also from many of the leaders, Heather and others in the community who are working on this, and then did his best to come up with a draft. I think he's been scrambling a bit, and we might have to keep working through it, but wanted to go through what we have, and ultimately it'll probably make sense to do a work session on this, wouldn't you think, Mr. Chair? So we'll kind of talk through it, maybe give him some feedback, see what we think initially, and then maybe work with the whole body to make it the best it can be. If that sounds good to everyone? Sure, yeah.
This says draft on it, but wasn't something already introduced, or this is a new?
It's a whole, yeah.
Or it says for reading on the 21st, is that just a typo?
If I stayed on schedule, it would have introduced it.
That would have happened.
So we still have two other ordinances that are separate for tobacco 21 and for the other one. And those were postponed to June 4th. And the plan was to postpone indefinitely release the subject as one instead, but it hasn't been submitted yet.
And that's okay. I mean, we'll just keep working through it and making it better, but I think the plan is, yeah.
Yeah, the good work product is very important to me more than, I guess, the time frame that we set out initially. So, but I apologize, it's taking longer than expected. I guess if when the time was to jump into the draft here.
Sure.
And I also thought that going forward, we still wanted this reintroduced on 21st and full body on June 4th. I don't think that's possible, but I think that there's details if you want to look more closely at and not rush it that much. If you want to introduce on the 4th, the next comedy meeting, as I understand it, is June 19th. It's after the June 18th assembly meeting. And so if you want to get this again, this committee, because there's the July 9th.
So I'll be interested to hear what Ms. LaFrance thinks and all of the rest of you, but I think we should look at this now, give you some feedback, get a more complete draft. I haven't looked at this yet, but whatever you incorporate that you hear from us, and then have a work, and then we can introduce it and have a work session. So that, I don't personally have any interest in rushing to do it by June 4th and then having it on the addendum and people haven't read it, and that's.
Perfect. Thank you.
I would agree with that.
This is hard process, so nobody's really read this latest draft. It's got the 15, 19 at the top of each page. So there's no real changes to the last paragraphs, except I had one about secondhand smoking that you cut out. This doesn't address secondhand smoke ordinance changes at all. So section 1 is new, and adding a new section that has the definitions. And I guess I should mention that I said that a lot of the reason I was taking on from expected, trying to incorporate this model policy right from, I guess it was issued April 12th, and we just got this April 15th coming. So it's really fresh. There's nothing for sorting in this week out, some considerations. But looking at that, then the state bill passed last year and incorporating this statement I expected. So what I did here in section 1 is a new section that's definitions that apply to the next 7 sections in our code in chapter 1470. They are not marked because the whole section is new. I wanted to do this because if someone looks at just section 157030, they might miss the definitions that were in 157020 where they have been before that were supposed to apply to section 3 as well. So I think looking at how we read the table of contents, usually you see the standout definitions applicable to these next sections. So anyways, the electronic smoking device definition, page 2, line 20, this is almost exactly like the model policy that we have. And then this definition is stuffed into the definition of tobacco product. That's at line 46 on page 2. So tobacco product includes a bunch of stuff, including an electronic smoking device. So if the electronic smoking device is under tobacco product. And then if throughout the rest of the sections, we use the term tobacco products, which will refer to everything that's in these 2 definitions, tobacco product and electronic smoking device. They call that stuffing the definition.
Okay, Mr. Johnson, go ahead.
Yeah, so I see on page 3, line 11, you define that it does not include, or lines 10 and 11, marijuana or marijuana products, the line tobacco product. But when I look back over at page 2, section 005, lines 20 through 30, it reads, electronic smoking device means any device, et cetera, that may aerosolize or vaporize a product. That seems to be separate from the definition of tobacco product, which could be read that any device that will provide for the inhalation of an aerosolized or vaporized substance of any kind could be banned. And so I want to make sure we're clear in the language that this exclusion in Part C is also covering that first definition.
Can I just add along those lines? So I'm just, we're all absorbing this now, but the last sentence in that same electronic smoking device definition paragraph says it does not include drugs, devices, or combination products authorized for sale by US FDA. Okay. But what about drugs that are not authorized, that are federally illegal?
Right. That's because it's just hard to understand, because electronic
I feel like
smoking
I'm so
device
absorbing it.
includes any component, part, or accessory of the device, also includes any substance intended to be aerosolized or vaporized, any substance.
Yeah, Mr. Bennett?
So
Something different, okay. Go ahead, Mr. Gates.
These definitions will only apply to these specific offenses here. So, whatever happens in Chapter 10 about smoking marijuana on site and so forth wouldn't be affected by what we define here. It's only applicable to these sections about selling tobacco. And I think they would have a good point. We should probably, I think you can connect the dots and say marijuana is not included, but it would be clear if I also put marijuana products as an exclusion in the definition of electronic smoking device.
Okay.
So,
Thank you. Mr. Jumper, you want to wait till he
But
goes
does it-
through more of this?
Well, we don't have a lot of time, so I'd like
Yeah.
to get it to just jump to it if you could.
Okay.
So on page 5D, big C,
Oh,
starting
okay.
on line 7, there's discussion about people who can work in retail adults only tobacco store. And the way I'm reading it, I was looking otherwhere in the ordinance, trying to figure out what the rules are for people to work in, a gas station that also sells cigarettes, or Fred Meyer that also sells cigarettes, for example. And so my first question is there somewhere other that I'm not seeing somewhere else in this ordinance that deals with that? Or is it just implied that people can work in those kind of establishments regardless of age?
I didn't catch that last part. What's implied?
So this is talking about retail adults only tobacco stores. But what about those stores that just happen to sell tobacco but sell a lot of other things as well? What are their rules? I couldn't see it. I couldn't find it.
I don't understand what you're saying now. Other interests, that's...
Okay. Well, I guess then, regardless of instead of looking for it now, Dean.
I do need to address that.
Okay. So I just want to make sure this is a draft for the next draft. The next draft addresses that because Mr. Peterson put forward an amendment that we passed on one of the earlier versions that was supposed to be put into this omnibus to make
I'm
sure.
looking to have that here. I think you're right. That I use
Okay.
making sure that it's clear.
Yeah.
That's all the other terms.
Yeah. And then the second part of that is during that debate, Ms. Wemhoff opposed Mr. Peterson's amendment and also asked for something like in subsection 2 where it talks about basically a sunset date. But she lost that argument at the time. We passed the amendment as Mr. Peterson intended without a sunset date. So I would like that sunset date taken out of the draft. And then if someone wants to put it back in by amendment, fine. But the ordinances that we're sort of merging here had Mr. Peterson's clean amendment that said basically we're not going to require you to fire 18 and 19-year-olds.
And that we weren't going to create this weird status of people who were that for some years.
Right.
Go ahead, Mr. Gates.
So my intent here was to sort of distinguish between retail adults only tobacco stores.
Okay.
And about that. Well, that's some policy question I wanted to bring to you guys.
Okay.
I think that if it's only adults only retail and usually aged to 21, why did you have it allowed to hire people 18 to 20?
I think it was saying
forever. So this is only grandfathered for those that are employed now in adults only retail stores. I think Mr. Peterson's intent was those gas stations and all that.
Well, we also
and
have received.
to have that grandfathering for those employees at that station, for example, for a while.
We had also received an email from an employer that I think was a tobacco-only store that said, I'm going to have to fire a dozen kids, basically. So I think that his amendment was motivated by that as well, but I could be mistaken. You should talk to him about it. And I guess that is a separate policy discussion. But
I recall Mr. Peterson did that in response to a letter from the manager of the holiday station stores.
okay, I could be mistaken then.
I don't think we were thinking of retail adults only stores.
Would you,
Okay.
Mr. Gates, would you mind talking with Mr. Peterson about that and working on following up on that prior to when we all meet as a group? And then Mr. Rivera has a question.
Thank you, Madam Chair. So, in terms of process, I just wanted to see if we could gel and agree on. So, rather than introducing this item in preparation for any specific meeting, I would prefer that this ordinance goes to the Rules Committee or a drafting committee to work on it before it gets introduced, because it sounds like there's still quite a few changes that need to be made.
Thank you, Mr. Rivera. And we also, right now, Suzanne, John, and I are the sponsors of this, but we haven't even seen it. So perhaps what needs to happen is we need to take some time with Mr. Gates and go through it and read it and give some feedback, and then we could maybe see what shape it's in. I don't know. I agree with you. It needs some work.
like to say, Mrs. Chair, I think the sponsors, you know, like, works up to what the sponsors want to see, some policy choices to make, and then perhaps bring it to the rules committee, whichever is
Okay.
next.
Is it most appropriate, Felix, to go to the rules committee or have a work session, or what's the rules committee's role? And
So this is great. This is a precursor to a work session we're going to have on Friday. But Rules Committee is a good place to see something while it's in draft form, so that you review it in draft form. You can make edits to it in draft form, but it's not on the agenda. So it
Right.
doesn't provide that very timeliness factor. We got to get this done before it's on
Right.
the floor, so we vote on it.
perfect, and that sounds like a great solution to a lot of the inefficiencies we've seen on the floor. So thank you.
Like I said, I think also technically work sessions are supposed to be information gathering, not debating specific language.
Right.
We don't
Good
really
point.
do that. But, I mean, if we want to start using the rules committee more often, I think that is a more appropriate use for it.
Okay, that sounds great. Then I think we can work as a sponsors. You could check with Pete on his idea, because I don't want there to be more than 3 of us, and then we can put something forward, and then we'll discuss as a group the rules committee. Yeah, Mr. President.
But procedurally, I would offer that the rules committee can be more functional, yes, great, but the committees themselves also do that function. And so if the opportunity and timelines would work out, this is also a good venue for that conversation without resorting to an extraordinary body. So this is a reasonable committee from a content perspective to be working on this policy. So it can go that way, great.
So we could do it here as well.
Right, yeah,
Okay,
and-
well, maybe we'll get it in good shape, and then we'll see, we'll check with you.
Timing, it's really a timing issue, because the rules committee is more flexible in terms of when it can meet. It's not a standing committee,
But it's a committee of the whole.
and it's admittable, right?
Okay, since we're running out of time, should we extend a few minutes and let Mr. Gates just run through it sort of conceptually, and then people can think about it and give feedback between now and whenever?
I wouldn't mind, but my introvert has to be for, you know.
Okay.
Graduation ceremony.
Okay.
Never said. So,
Oh, sorry.
I could read your questions or something.
Yeah, I think we're okay. I think that it's perfect timing. We'll just take this and we can all absorb it, and then, we'll bring that feedback to the rules committee or to this.
If you want
Is that what other crowds did?
It's okay. It's fine. And I think if people have feedback, tell me if this is appropriate. Could they tell Dean?
Yeah.
Okay. And then Dean could talk with us about whether we